So while health experts say we're not in the acute pandemic phase anymore, we're also not in the endemic phase. We're somewhere in between. When a virus is endemic, that means that it sort of doesn't really cause any disruption. It's sort of there, we live with it. It's very similar to the, common cold. A pandemic causes a lot of disruption in terms of people having to stay home, but also hospitalizations, severe illness, and deaths. We're not experiencing devastating numbers of hospitalizations and deaths like we had in the prior surges because of the presence of vaccines and antivirals and other therapies. But we're not totally out of the pandemic yet, and we're not in the endemic phase yet. Health experts say we're sort of somewhere in the middle. Health experts say, we're definitely going to be dealing with this surge on, surge off waves for the next couple years for sure, but it's really hard to tell when something will become endemic. If a new variant emerges that causes more severe disease and is able to evade all the immunity that we've been able to arm ourselves with, then we're starting from zero. We see that the SARS-CoV-2 is still very disruptive to our lives. It is still causing hospitalizations. It is still causing deaths. Another reason why scientists say that the virus is not endemic yet is because we haven't really decided what the acceptable level of SARS-CoV-2 transmission will be. So, every single year when we have the flu, we sort of have a predictable level of what the flu season will look like. We don't have that with COVID yet. If we look at the definition of what an endemic virus looked like, it would have a sort of a low level of transmission. It would, during a certain time of the year, possibly, in certain parts of the country, and it wouldn't cause a lot of severe illness, a lot of hospitalizations, and a lot of deaths. That would be sort of the quintessential definition of an endemic virus, but we just don't know if COVID is capable of that yet. I mean, obviously, we're done with COVID. I want to be done with COVID. Everybody wants to be done with COVID. But what health experts keep telling me is that COVID is not done with us. It's important to be cautious still. And it's possible to get to this endemic phase. But in order to get this endemic phase, we need immunity. And the way to get the best immunity is through vaccination. So it's important to keep up with that.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.